Hello to everyone and welcome to this week's vlog. So last week we chatted about AHS assessment centers, and this week's vlog is kind of a follow-up to that discussion in that we'll talk about a crucial next step when a COVID-19 test returns positive. And that step, of course, is contact tracing. Contact tracing is a process of figuring out all the people who've come in recent contact with an individual who has a communicable disease. And by doing so, we can ensure people who are infected can be isolated and reduce the risk of them passing the virus along to others. Contact tracing is especially important during this pandemic because we don't have some of the tools that we typically have to stop disease transmission. And in fact, wide-scale testing and contact tracing are amongst our best tools to slow the spread of COVID-19. So with me today are three guests to talk about contact tracing efforts. They are Dr. David Strong, who's our lead medical officer of health, Communicable Disease Control. We also have Maureen Rutz, a Communicable Disease Control nurse in Red Deer, and Adam Bizuk, a clinical development nurse in Edmonton, both of whom are working as contact tracers. So thank you so much for joining me today. So David, let's start with you. Can you give us an idea of how our contact tracing efforts have grown since March, and how many people are right now involved in contact tracing?
Contact tracing, it's a core element of public health. We do it all the time. We do it for measles cases. We do it for meningitis cases. It's really about, as you said, trying to identify, once we've identified a communicable disease case, trying to identify potential sources for that case and then potential people that would have been infected by that case. And for most or many of the other infectious diseases, we might actually have like a prophylaxis, either a vaccine or antibiotics that can stop the continued spread, even those people that are being exposed. We don't have that with COVID, as you pointed out. So our main tool is the isolation part. So we normally have about 36 nurses, public health nurses across the province that do this kind of work. With the scale with COVID-19, we had to really rapidly get our workforce up. We're at one point with our first wave, we were having about 40 redeployed health staff. That's when a lot of services were shut down and we had the opportunity of getting those staff. We also had a pool of almost 300 medical students that were doing this contact tracing alongside of our usual contact tracing nursing staff, public health nursing staff. With the resumption of school, medical school, and other services being opened up, we lost a lot of that workforce. So we've been gradually rebuilding up a core workforce to manage up to about 125 new cases a day. So right now, today, we'll have 101 RNs and LPNs working, along with 37 other regulated health professionals and 20 non-regulated health professionals. There's recently a change in the regulations that allows us to use non-regulated health professionals, and we're going to have to rely on them quite extensively, going forward, as hopefully the case numbers won't go up dramatically higher than what they are, but we'll be ready for that.
So Maureen, when you call an individual who has tested positive for COVID-19, what are your goals for that conversation and what kind of information are you looking for?
One of the main goals is, how did they acquire the disease? Like, where were they exposed? So we do ask a lot of questions like, did you travel recently? Were you out of country? Did you fly somewhere? Were you in contact with somebody that maybe had some respiratory symptoms? Were you in contact with somebody that that has COVID-19? All those kinds of things are the questions that we're asking. Were they working somewhere where they potentially may have been exposed? So we're looking at, about 14 days prior to when they developed their symptoms. Where have they been? Where would they have potentially been exposed? Another big role of what we have and goals that we are trying to promote are, isolation. Of course, that's the big thing. Ensuring they understand what isolation means, that unfortunately they cannot leave their homes, they have to utilize supports to bring them food, those kinds of things. Because again, we don't want this spreading anymore. And then, of course, lastly is helping them identify which close contacts they've been around. So, For some people that can be really difficult, you know, because again, depending on where they've been, those kinds of things. So, but again, we want to ensure that we're going through that information with them. You know, where have you been since you've been infectious? You know, who have you been in close contact with? Have you been for a walk with somebody? Have you, you know, have you been working? Have you spent some time with loved ones? You know, those kinds of things. So those are the main goals that we're looking at when we're doing our investigations for a new case.
I can't even remember what I did yesterday. So
Yeah.
to ask somebody who did something 14 days ago, that must be a real challenge.
Yeah, yeah. You know, have them look at, you know, their calendars, those kinds of things to say, okay, where have I been? And sometimes that, yeah, like you said, it can be very difficult.
Yeah. Adam, coming to you, we know that you speak to a wide range of people. So maybe let us know what those calls are like for you. What are some of the questions and concerns that you might hear, and how many people do you actually talk to in an average day?
Calls can vary quite a bit. You know, some people, it can always come as a bit of surprise to how the case will take the news. Generally, though, people are fairly accepting and appreciative of the call. I mean, they've sought out the health services to get that testing done, and so they're aware there's always that potential that their result might be positive. And so, for the most part, some of them have taken already precautions while waiting for those swab results. Like Maureen mentioned, you know, the calls are centered on providing education and support as to what COVID-19 is, you know, what it means to be infected, and how long they're communicable for, and what being under isolation means. And if they identify any problems or concerns with the isolation, we do try to utilize community supports where available to try and help support them remaining in isolation for the duration that they have to be. However, sometimes people can be a bit frustrated with the duration of the isolation and the impact that means on their life. And so, again, if the additional supports we provide aren't sufficient, or they still have concerns beyond that, or if they, some people are unfortunately a bit resistant to isolation, in those kind of instances, we do loop in the medical officer of health team who works in tandem with other community supports such as environmental public health, who can you know, reach out to the client and case and see what other kind of options we can examine if needed. The common questions that typically come up is again that financial impact that sometimes people indicate that might present to them. And so in those cases, you know, with their client's permission, like we'll sometimes touch base with the employer as well, just so the employer is aware that their staff member has to be isolated for, you know, for the duration of the illness. As well as, you know, they also have questions on how to best reduce the spread of the illness within the household if they have roommates or loved ones. And so we do go over what kind of infection prevention and control measures they can do within the house and how to best mitigate the spread within the households. There's also questions frequently come up about getting like a clearance swab, as some places of employment request that, which is not needed. And we do explain that to both the case as well as to the employer if needed. As well as if they're asymptomatic, but they tested positive, so they feel fine, they have no symptoms. Sometimes that becomes a question as to why can't I go out and about? So it's just, again, providing that education as to why they're under isolation, and because they still have that risk of potentially transmitting the disease. How many cases an investigator can follow up with per day will vary widely. Some people have relatively homebodies with few contacts, whereas others are social butterflies, really utilizing the maximum number of that social cohort they're allowed to have. And that can lead to quite extensive investigations and following up with those individuals. But on average, I would say you can probably follow up with about 3 or so cases a day.
Once you've had that initial conversation and you know that people has actually been in contact with somebody who's been infected, what happens after that?
So after we've identified who the close contacts are, we do reach out to those close contacts. contacts. And again, the calls are centered about informing them of their exposure to COVID-19, increasing their knowledge of it, how it's transmitted, how to go about having testing done, and what symptoms to watch themselves for. And then we also advise them that because they are considered a close contact of a COVID-19 case, to help reduce the spread of COVID-19 within our community, they are to isolate for 14 days following that last exposure to a case. They also have questions about, if the testing is negative, does that eliminate the need for isolation? And so just again, explaining to them that no, the test is more so for like a current point in time, but just because it's negative, within that 14-day period, that incubation period, you might still develop symptoms. And so it's for the duration of the 14 days that they have to remain under isolation.
Maureen, what are your biggest challenges as a contact tracer? Are there particular skills that come in handy? Do you have any tricks of the trade to jog people's memories?
There's a lot of information out there that is in the media, on the internet and everything like that. So people sometimes will get frustrated because they're hearing one thing from, what they're reading and then what we're telling them, those kinds of things. So those are some of the challenging things that we have to go through. So, of course, making sure that they're going to reputable sites, referring them to Alberta Health Services website, Alberta Health website for the current information and giving them as much information so that they're not confused by all that information out there. It's very difficult to remember if you're, like Adam said, a social butterfly to remember where you've been. So again, if we have a case that identifies that, oh dear, I've been here, here, and here, and here, but, I just can't remember what days those were. Was that during my time of infectivity? Those kinds of things. So some kind of, tricks of the trade, or, have them take a look in their calendars, take a look in your, bank statements, look at receipts. Sometimes, especially if it's the younger population, have them take a look at their texts or their social media, their snaps, and sometimes just even asking their household contacts, those kinds of things. So I think, again, with a little bit of pandemic fatigue, we're definitely seeing a lot more contacts than we did before, when we were initially doing our, first investigations. So that's been challenging, but again, we find ways to help individuals find that information for us so that we can stop the spread.
David, do you have any metrics that show the impact of our contact tracing effort?
What we're trying to do with contact tracing is breaking chains of transmission. So what we're looking for is no secondary or tertiary generation cases, no further ongoing spread. Normally we can do that with measles quite easily because it's a single case of measles that comes in. With COVID, we're getting over 100 cases a day now. So being able to track that is a challenge, but we're putting that into a dashboard. We'll pull that out of the back end of our contact tracing information system we've got. We just don't have that dashboard built yet. So as I said, at one point we'll be wanting to try to track any second and third generation cases, and that would be an indication of how successful we're being. Because again, the isolation that we're recommending people undertake should stop any further ongoing spread. The other measure we're looking at is the number of clusters that we can identify through the contact tracing program. So with the number of contact tracing investigators that we have, they may not be able to identify common exposures across multiple cases. So we're going into the back end of our CDOM system and pulling out the occurrences within the contacts where they have a common exposure, and then that can be investigated by our contact tracing team and also environmental public health, and they can go to those sites, try to identify if there's an ongoing risk of transmission in that site and put in measures, enhanced precautions, for example, or even closing down facilities sometimes if necessary.
We know that as we head into the fall, I'm dreading the fact that we're going to be heading into influenza season. So how will our contact tracing efforts look as we approach that time?
Yes, so we're all a bit worried about that, or very worried about that. Maybe the good news is Australia seemed to have a very blunted influenza season. even though they had a surge in COVID, and likely it's due to the measures we put in place around, or they put in place around COVID that's restricted the amount of spread. But we're going to be going into a season where there's other viruses and flu going on. So it's going to increase the initial workload, which is obviously getting people tested. What we'll be introducing in the fall would be when we test a symptomatic person for COVID, we'll make sure they get tested for flu as well, so we can differentiate them, the cases. As far as the contact tracing goes, though, we won't be doing contact tracing. Once you confirm it's flu, we won't be doing the contact tracing. So it shouldn't really impact, flu itself shouldn't really impact the amount of work that the contact tracers will do, because it's strictly going to be the COVID positive cases that they will be following up on.
So I really want to thank all of you for joining me today. It was just fascinating listening to what you do with contact tracing and how important it is in our strategy to fight the spread of COVID. So thank you to you and your teams for your important work. As I said earlier, our testing and contact tracing efforts are among the best tools to slow the spread of the virus in the province. And that will be especially true as we head into fall, when we spend more time indoors and seasonal influenza begins to circulate. So we really must stay vigilant with physical distancing, hand and environmental hygiene, and masking to ensure that we protect ourselves and others. And I'm confident we're going to be able to rise to that challenge, just like we've been doing over the past 5 months. So thank you all for watching. Please take care of yourselves, stay safe, get some breaks over the nice summer days, and especially please continue with our continuous masking requirements. And I'll see you for the next vlog.
Together, we do amazing things every day.